Okay, good afternoon. I'm David Gordon, and I'm the Professor of Social Justice in the School for Policy Studies and Director of the Bristol Poverty Institute. And I'm the host for the visit of Nkechi Owoo to the University of Bristol for one of the first next generation scholarships that the university has been awarded this year. So in the past, there used to be scholarships for visiting academics, but they were mainly for old professors like myself, whereas now I'm very pleased to say that we are also inviting younger or up-and-coming scholars like Nkechi to come and visit us rather at the middle of their career rather than at the end of their career, as we have in the past. Nkechi is one of the foremost young scholars in Africa. Her research focuses on the links between health, environment, sustainability and well-being, and she explores the effects of climate change on health outcomes and how these relationships are affected, moderated and mediated by poverty. And her talk is going to focus on three critical issues for the 21st century: health, climate change and inequality. In her day job, she is a senior lecturer at the Department of Economics at the University of Ghana, which is one of our worldwide university network partners. She is also a visiting scholar and member of a number of prestigious organizations, including the Africa Research University Alliance's Center of Excellence for Inequality Research, which is based at the University of Cape Town, University of Ghana, and the University of Nairobi. It's one of 13 Africa Centres of Excellence in the research-intensive universities. After she is finished visiting Bristol at the end of the month, she will go on secondment for a year to the World Bank, and then go to South Africa to do some more work at the Africa Centre of Excellence. I'm going to share her slides on the screen because this is being recorded and shared online. Can you see it all? Okay, so please can we welcome Nkechi for her lecture.
Thank you very much for the introduction, Professor Gordon. And I'm very pleased to be here with us. Thank you for coming. So today I'm going to be talking about research that Professor Gordon and I have been involved in, looking at the effects of climate change shocks and sensitivities on mental health outcomes in Ghana. Okay, so this is the outline that the presentation is going to take. So we've seen quite a bit of research on climate change over the years, and a lot of them have been focused on economic and then environmental impacts. We have seen some research also look at the health impacts of climate change, and more often than not, these have focused on physical effects. So things like how climate change affects respiratory and cardiovascular diseases, how it increases waterborne illnesses and other infectious diseases. But this is despite the note that a lot of the important health consequences of climate change actually will be on mental health. And there are a number of pathways through which this can happen. So for example, individuals can witness climate change events, perhaps see people lose their lives or get really seriously injured and therefore develop post-traumatic stress disorder. They also develop depression or substance use disorders. Another channel is that climate change events can lead to displacement, unemployment, food insecurity. And then there's also research that suggests that higher temperatures can affect people's moods and then lead to increased stress. We can have situations where climate change can also lead to damage to health infrastructure and therefore affects the provision of mental health services. There are even some studies that document that people who haven't necessarily experience climate shocks themselves, just by hearing about it, can experience increased stress levels. So there are a number of different pathways through which climate change can affect mental stability or depression status. And so far, we know that a lot of the research that has been done trying to link climate change and mental health has been conducted mostly in countries in Europe, North America, and also in Australia. And this is despite the fact that it's well known that a lot of the areas that have been deemed most vulnerable to climate change are actually in low and then middle income settings. So I want to talk a little bit about the situation in Ghana. Now, Ghana is characterized by an average annual temperature of about 28 degrees Celsius. And there was a recent World Bank report that came out and said that the number of hot days and nights have actually increased by about 13% and 20% respectively from the 1960s levels. We've also seen increasingly irregular rainfall patterns, triggering floods, droughts, and so on and so forth. And these have effects on health and also production activities. According to the same report, we can expect to see more of such variable weather going into the future. Now in Ghana, we have seen some research focusing on depression and mental health, but this often focuses or talks about the potential effects of climate change shocks. So we have research on maternal depression, on depression among graduate students at the universities, depression among healthcare providers themselves, and in some few cases, we see some researchers trying to link depression and then mental health. But unfortunately, it is plagued with a few challenges. So first of all, a lot of these studies are not nationally represented. That's not surprising because we don't have a lot of access to national data on climate change shocks at the country level. And then, so we have this study by Akari Bassam and Anuga that looked at, just as was a localized study on farmers in the north, where they found that these individuals were not properly internalizing what's going on with climate change shocks and therefore had higher proclivities for being emotionally unstable or mentally distraught sometime in the future. These studies are scarce, but also for those that have been done to look at the connections between mental health and climate shocks, the techniques have not been very empirically robust. There was this study by Jiwonu and Kube in 2015, where they simply used t-tests to look at mental health outcomes for flood and then non-flood victims. A lot of these studies have also been cross-sectional, and we know the benefits of panel data for the analysis of some of these outcomes. So in this paper, what we try to do is to address some of these limitations with the existing research. And so I want to present some of the research questions that we try to answer with this paper. So first of all, it's important to be aware of the spatial distribution of climate shocks and also household level sensitivities as they exist in Ghana and how these have changed over time. In addition to that, we also carry out hotspot analysis to be able to pinpoint geographical positions in the country that may be driving any observed spatial autocorrelation in climate change sensitivities. We also look at the prevalence of depression among different subgroups. So that's looking at women versus men, rural versus urban dwellers. We look at the prevalence by poor and non-poor households and also across different age groups, so adolescents, adults, and then the elderly. And then finally, using our panel data and a series of robust regressions, we look at the effects of climate shocks and then sensitivities on mental health outcomes, approximately by depression. We look to see whether these effects vary among different subgroups of the population, the ones I talked about earlier on. And then finally, once we have answered the question about the link, the question on the link between climate shocks and depression, we go ahead to see to what extent these connections are mediated by the personality. So now I want to talk a little bit about the data that we use to answer these research questions, and then also how we measure some of the main study variables, the explanatory variable, and also a potential mediating variable. So to answer the research questions, we use data from 3 waves of Ghana's Socioeconomic Panel Survey. Now, this is a nationally representative data set with information on about 5,000 households in wave 1, about 4,700 households in wave 2, and about 5,00007 households. The information on climate shocks is actually retrieved from the GDIS data set, that's also based at the emergency events database. So here at the country for Ghana, there's actually information, GIS information on the location of these disasters in each year. So in order to do the analysis, what I do is simply to merge the districts. There's information for the districts in which some of these events are taking place in the GDIS. I simply merge that with the district information in the GSEP's household survey. So having given a brief description of the data, I want to also talk about how we go about measuring some of the main variables, starting with the outcome variable, that is depression. So depression for this analysis is measured using the Kessler psychological stress scale, popularly known as the K10 scale. So here, there were 10 questions asked on individuals' emotional states, and you have the questions represented in the table on the right side of the slide, where they were asked during the past 4 weeks leading up to the collection of this data set. How often did you feel tired out for no good reason, nervous, so nervous that nothing could calm you down, and so on and so forth. And then responses were given. So 1 was coded none of the time. If they said a little of the time, coded as 2, some of the time 3, most of the time, all of the time 4 and 5 respectively. So then responses were summed up from these, the scores were summed up from these 5-level responses. So you had someone with a minimum of say 10. If they responded, none of the time to any of these questions, or a maximum of 50, they responded all of the time, and you have the range in between. So here, higher scores were indicative of greater psychological distress. And even though I am aware that there are other ways of measuring depression or mental health, this K10 scale has been used quite widely in both developed and developing countries. Fine for the purposes of this research. So I want to talk about a second of the main study variables. So that's cold level climate change sensitivity. So it's one of the explanatory variables that we use in the analysis of the determinants of depression. So the household level climate change sensitivity is constructed across 4 main dimensions. So we have demographic, economic, housing, and then nutrition. And then for each of these dimensions, we have a series of indicators that I think properly represents the dimension. And then I have in the last column the rationale for why these indicators would lead to increased or lower climate change sensitivities or vulnerabilities within the household. So when we take the demographic dimension, for example, we have children under 10. The thinking here is that babies have a lower resistance to heat stress, for example, because of their limited capacity to regulate their temperatures. Young children also could be relatively short, light, not be strong enough swimmers, could easily be swept away during a flooding situation. The presence of elderly members above 60 years of age would also increase a household sensitivity or vulnerability, because studies have shown that they are more sensitive to heat waves, especially if they have pre-existing conditions, hypertension, and so on and so forth. Studies have also shown that the presence of pregnant women within the household could potentially increase the household sensitivity to climate shock events, because there's a higher risk of spontaneous abortion and other complications. The presence of disabled members also would presumably increase the household sensitivity. And then with the economic dimension, that's predominantly individuals who are engaged in occupations that would leave them outdoors for a long period of time and leave them exposed to the vagaries of the weather. So people who are engaged in agriculture, fishing, building and construction, people who are engaged in the informal sector, maybe for sales and then service, exposure to increases in temperature, poor air quality, all of these could predispose the households to be more sensitive, a lot more engaged in these outdoor occupations. And then with respect to housing, we have 4 indicators under this dimension. So a household is categorized as being more vulnerable or sensitive to change if their floors or walls are made from natural materials like mud and earth, which could be more easily swept away during a flooding situation. Surface water, if the household uses a lot of its water from surface sources, could actually experience an increase in vulnerability to flood and drought. Same thing with sanitation. If open defecation is is the way that the household goes or the use of unimproved sanitation, and also leads to sewage contamination in a flooding situation. Access to information is also one way that we tend to categorize households as being sensitive or not. So if they have absolutely no information, no access to TV, radio, or internet access, that would help to give them information or provide disaster warnings in the event of climate events, say that that household is likely more vulnerable or sensitive. And the nutrition is linked to health outcomes, and if you have a household that has more children who are stunted or has higher food insecurity, this could lead to poorer coping strategies, lead to weaker responses. So that is one of the main explanatory variables. And then, so to calculate or to create the average sensitivity index, we simply use the weighted sum of the scores from all of the 11 indicators that I just talked about, and you have the formula for that on the slide. So once we take the average of these indicators, we have this index that ranges from 0 to 1, with higher scores indicative of greater household sensitivity to climate change. Now, in addition to this overall sensitivity index, we also created scores for each of the 4 dimensions of climate change, so demographic, economic, housing, and then nutrition. The second explanatory variable for this paper is the number of shocks that households, or shock events or climate change events that households have experienced in the years of data collection, but also preceding that. And in this figure, I'm showing for the GDIS data set all of the years of information that are recorded where we had climate shock events in the country. So it ranges from 1 in 1916 to 2019. But for the purposes of the analysis, I'm only going to be focusing on the shocks that happened around the time of the data collection for ease of comparability. So in wave 1, for example, the data was collected in 2009 and 2010. And so you can see that the shocks information was taken for wave 1 using events that happened in 2008, 2009, and 2010. For wave 2, the data was collected in 2013 and 2014, but there are no events that have been recorded for 2012 and 2014. We use the 2013 information. And then for wave 3, that information was collected in 2018 and 19. And so we use the climate events that happened in those years and then the ones in the year. And then I want to talk about the final main study variable. That's the data on personality traits, which we think is a potential mediating variable for the relationship between climate shocks and sensitivities and then mental health outcomes. And for this, we use the big 5 personality traits categorization. And here, a series of about 44 questions were posed to the household head, the first spouse, if it's a partner, and then or the only spouse, if it's a partner, and then another random household member above 12 years of age. And based on the responses, individuals were giving scores on 5 major personality traits. So the traits were extraversion, you have that table over the extraversion, agreeableness, conscientiousness, neuroticism, and then openness. So on this slide, I'm just showing the descriptive statistics for the main variables that I just discussed, how we went about constructing. So we have first our depression scores. Remember I said that we're using the K10 scores, which range from 10 to 50. And so you can see how this changes over time from 2009 to 2014. It reduces, but then increases by 2019. And then we also have the average sensitivity scores, which range from 0 to 1. Higher scores being greater or higher household sensitivity or vulnerability to climate events. So that appears to have decreased, even if only slightly over time. And if you look at the different dimensions of the climate change sensitivity, we see that with the exception of economic and nutrition dimensions, demography and housing vulnerabilities have also declined over time. And then with respect to the number of shocks, average number of shocks that individuals have recorded, it's quite high in 2009, as you saw from the data that I showed earlier on. It fell in 2014, and then it's a little higher. We also have information on personality traits for the individuals in the analysis. And I should mention that this information on personality traits, these 44 questions were only administered in the first wave of the survey. And so therefore, for subsequent waves, we're assuming that the personalities don't change too much by the time we get to 2019, we use the same information on these individual clusters for all of the waves of the analysis. And then this a lot of, I just wanted to give you an idea of some of the other when I show you the results from the regression analysis. So there's information on the amount of time that individuals are spending in housework and then childcare responsibilities, the gender of the respondents, assets-based poverty categorizations for the household, age, marital status, education, rural versus urban residents, the size of the household, working in paid employment, religion, ethnicity, and also the regions. So these are some of the controls included in the regression analysis. And now I want to talk about some of the methods that we are using for the analysis so far. So this is mostly three main analyses that we are doing. So there's a spatial analysis, the one that is more descriptive, and then finally regression analysis. With the spatial analysis, this involves a spatial mapping of the distribution of climate shock events in the country, and also corresponding sensitivities in the country. There's also hotspot analysis, as I mentioned before, to try to pinpoint areas within the country that have very high sensitivities to climate change versus those that have very low sensitivities, and just how significant the spatial relationships between geographical units are. There are descriptive analysis to also try to show the prevalence of depression among different subgroups of people in the country. So we do this by gender, residence, poverty, and also age groups, and then we show how these change over time. With respect to the regression analysis, because of the count nature of the from 10 to 50, we opt for a Poisson, fixed effects Poisson regression model specification. And I'd like us to pay attention to the 4 different specifications that we're running here, and because that's what the results table will be based on. So in the first specification, we're running the effects of depression on only climate change sensitivities at the household level, controlling for other variables, but not climate change. In the second regression, we regress depression on shocks, but not sensitivity, controlling for all of the other variables. And in the third specification, we regress depression on both sensitivity and shocks, controlling for all of the other variables as we saw earlier on. And then in the final specification, again, we regress depression or mental health outcomes on shocks, but this time not the overall sensitivity at the household level. We pay attention to the different dimensions, demography, economic, household, and then nutrition, controlling again for all of those variables. Additionally, we run these Poisson regression models by different subgroups just to see if there's any heterogeneity, the relationship between sensitivity, shocks, and then depression. And then again, we test to see whether there are any mediating effects of personality. We run a series of robustness checks, but I'm going to show the results from fixed effects quantile regression modeling. That helps us to see how the relationship between shocks and sensitivities and depression changes for different levels of mental health, individuals in the study. And I'm happy to present some of the very early results that we get from all of these types of analysis. So in the first part of the table, on the left part of the slide, we're shown, as I mentioned, a spatial, the distribution of shocks and sensitivities in Ghana across the entire country. And this is, so here we see, so the black dots that you see are the climate shock events, so these little dots you can see here. So they're represented all across the path, but you can see that there's also quite a bit of them represented along the coast and also in the eastern parts of the country, along the Volta Lake. And then you can see some also in the northern parts of the country, upper east, upper west, and that's also along the tributaries of the Volta River in Ghana. At the same time, you can see that we're also showing those multicolored dots that you can see are different levels of climate sensitivity. I talked about how this was constructed earlier on. So wherever you see the red clusters, Accra and then the central region around the Ashanti region, these are areas where we have very low sensitivity. So here the housing conditions are really good. There are no demographic sensitivities, food security is quite high, and so on and so forth. Now we can see a lot of these clustering of the red dots in the southern parts of the country, although we do see some red clusters also in the northern parts of the country. And for those who are very familiar with the map of Ghana, these correspond to the regional capitals in these northern parts of the country. Now moving away from the red dots, we also have the purple dots. Now the purple dots are areas with very high climate change. So compared to the red dots, these are households that have poor housing conditions, that have very bad economic vulnerabilities. A lot of the household members, so on and so forth. And here, even though you can see a smattering of the purple dots in the southern parts of the country, you can see that we have a lot more purple and then green dots in the northern parts of the country. And so this is to say that even though climate change events, we see them happen along the coast, along the Volta River and its tributaries, the degree of sensitivity of vulnerabilities are much higher in the northern parts of the country compared to the southern parts. That suggests that households in the northern parts of the country would require a bit more attention because they are the ones that are likely to be more heavily affected by the effects of climate change. And then move over to the right side of the slide. This is just taking each of the waves of survey data and then just showing again for each of these waves the sensitivities in each year, as opposed to the climate change events that we're also seeing from the GDIS. So, and then what we also do, so going forward from those clusters, we try to see, as I mentioned before, so we run this hotspot analysis, try to see what particular geographical locations are driving the observed spatial clusters that we saw in high sensitivity versus low sensitivity. And so even though I'm showing this only for the most recent wave of the data set in 2019, we did replicate this for all of the waves and the patterns are generally the same. So I'm just going to discuss what we found for the most recent. So first of all, we have a Moran's I index of 0.395. So this suggests positive spatial local correlation. What this means is that we have households with very high sensitivities surrounded by other households with equally high sensitivity. Same thing, we have households with low sensitivity surrounded by other households with equally low sensitivities. So these, the evidence of positive spatial autocorrelation is given by these red and then blue clusters. So we can see these areas in northern Ghana and then in parts of the Volta region where we have households that are very sensitive to the effect of climate change, surrounded by other households with equally high sensitivities. And then we have these clusters of blue dots here as well, where we find them in the Ashanti region, in the Greater Accra region, and then in the central region. But in addition to this evidence of positive spatial autocorrelation, there is also some evidence of the negative spatial autocorrelation. And this is given by these purple and then pink dots. So we have a lot of the purple dots found in northern Ghana. These are households with low sensitivities surrounded by other households with high sensitivity. And again, these are found mostly in the regional capitals of these areas. So in Bolgatanga, in Tamale, and then in Wa, suggesting that perhaps people who live close to the regional capitals are more protected compared to those who live in other parts of the northern region. We also have these pink clusters found in the southern parts of the country, where we have individuals with high sensitivities to climate change at the household level, surrounded by others with low sensitivity. And then on the right, you have the significance map, which is just letting you know how significant these spatial clusters that we are seeing are. Now, it's easy to make, so I want to point out that even though it would be easy to say that, well, then we have increased, sensitivities in northern Ghana, and then, southern Ghana is relatively better off with respect to sensitivity to climate change. I want to again emphasize that we do have a lot of heterogeneity in these two parts of the country. We do have households in northern Ghana that are less sensitive compared to others in southern Ghana that are more sensitive. So there could be other reasons that are explaining these heterogeneities in northern and then southern Ghana. And so this is why in the paper, we try to look at, so for example, the levels of depression and how it changes for different subgroups of individuals over time. So in this slide, we're showing the prevalence of depression by women and men, by urban and rural areas, poor and non-poor households, and also. Now, across board, we can see that over time, depression is decreasing from 2009 to 2014 levels, but increasing in 2019. Women also appear to have worse mental health outcomes. compared to their male counterparts. Depression appears to be higher in rural compared to urban areas, and also in poor households compared to non-poor. When we look at depression across the different age groups, it's lowest amongst adolescents, and it appears to rise with age. So we see some of the highest depression scores among people who are 60 years and then. And now I want to show the results from the fixed effect regressions that we run. So you can see two boxes on the screen. The first box is the regressions that we run without any controls for individuals' personality traits. And then the second box is the regressions that we run when we included these controls for personality traits. Just to keep the discussion focused, I haven't included the results from any of the other control variables. If you ask, I'm happy to tell you. So I want to talk about the first specification. So this first specification is showing when you run the regression, looking at depression on only climate change sensitivity, with no shocks, but controlling for all of the other variables that I showed. Initially, when we don't control for any personality traits, you can see that there are high and significant odds of individuals who are sensitive to climate change being depressed. However, once we control for personality traits, you can see that both the significance and then the magnitude of this coefficient reduces. So that's for the first specification. In the second specification, we look now at the effect of climate shock not controlling on depression. So these odds ratios, once we don't control for personality traits, appear to be passive and then highly significant. However, once we control for personality traits, you see that the significance is lost of its filter. In the third specification, we include both the sensitivities and the shocks in the regression. Initially, when we don't control for personality traits, you can see that the results suggest that there are higher odds of individuals being depressed when they are more sensitive to climate change or when they've experienced shocks within their districts. Again, once we control for personality traits, the effects on climate shocks completely removed, and then we see that the effect of sensitivities is less significant, and even the magnitude is also reduced. And then in the fourth specification, again, we control for climate shocks and then the different dimensions of climate sensitivities. And then once we control for personality, we see a lot of the results, sort of the significance levels drop or become no longer significant, with the exception of demographic and then economic vulnerabilities. Here, where households experience increasing vulnerabilities with respect to demography and then occupations or outdoor occupations, we can see that this increases significantly the likelihood that they are going to be depressed, even when we control for personality. And then on this slide, I'm simply showing the results from the Quantile, fixed effects Quantile regressions. And I just want us to focus on the first and second specifications. And of course, in these regressions, we add all the control variables. And so initially, when we look at this the gray line, this is showing the odds ratios for different quantiles of depression. So from the 0.10, 20, 30, all the way to the 90th decile, sorry. You can see that the odds ratios are increasing, okay, across all of the different deciles. And it's of course also positive, and these are highly significant. But this gray line is for when we do not include the personality. Once we do that, the results look more like this blue line. Okay, so it's still positive and significant, but you can tell that the effects are not as strong. Odds ratios much smaller once we control for personality traits. And we can also look at the effects of running these quantile regressions for the second specification, so the effects of shocks on depression, controlling for personality traits and when we don't. And when we do not control for personality traits, we can see that the odds ratios on the effects of climate shocks are a little lower. So we went ahead to also run these regressions for different subgroups of the population. And instead of showing you all of the 11 different tables, I'm just going to tell you what the results were. So we ran the regressions for men and women, and we found that both of these individuals, or these groups of people, have higher odds of depression. climate sensitivity and shocks. However, for women, when we controlled for personality, the effect actually was no longer significant. It only remained significant for the men's sample. Here, we found that higher odds of depression occurred with increased demographic and then economic sensitivity. With respect to household poverty, we didn't find any significant odds of depression with climate change shocks and sensitivities among the poor, once we controlled for all of the individual and household level factors. But among the non-poor, we found higher odds of depression with both shocks and sensitivity. Even controlling for personality traits, some of the significance of these were reduced, but we still saw higher odds of depression, increased demographic, and then. With respect to rural and urban residents, there were different reactions to shocks and sensitivity. So for the rural sample, there were higher odds of depression with more climate shock events happening in their areas. But with the urban sample, there were higher odds of depression with increased economic and housing sensitivity. The effects were in both of these groups, but then still significant after controlling for personality traits. We repeated the exercise for different age groups. We didn't find any significant effects for the young and the elderly. And then we also found that adults showed higher odds of depression with more shocks and increased economic sensitivities, although the magnitude of the effects, of course, after we controlled for personality. So to conclude this very long presentation, we found that climate change has important health effects, mental health effects. It's an area that's largely understudied, particularly in developing countries across the world. And we found that climate shocks in Ghana occur all over the country, but particularly along the coast, the Volta Lake, the northern parts of the country, where we see some of the tributaries of the Volta Lake. We found that climate change sensitivities are high in the northern compared to the southern regions, noting the different heterogeneities. And also, combined with climate shocks, there's the suggestion that the burden or the effects of these shocks will be greater for people in the northern regions because they have more household level sensitivities or vulnerabilities. With respect to our subgroup analysis, we found poor mental health among women compared to men, poor and rural households, and also among the run our regressions, we found higher odds of depression with greater climate shocks and increased sensitivities. An interesting result. However, we went a step further to see what the potential channel could be that was explaining these greater effects on mental health from climate shocks and sensitivities. And we found that it's largely attributable to personal traits like neuroticism. Okay? So this appears to increase individuals' predisposition to environmental stresses, and is one of the reasons why we see these strong relationships between climate shock, sensitivities, and also depression. Thank you very much. The background. Thank you for the question. So in the data set, there was information for some of these points on the total number of people, but not all of these. So I guess it was a choice between using that information or using at least the occurrence of a shock. The information on intensity would be contained in how many people were affected. Following up, I could see what shows. I'll lose some of the disaster points, but perhaps see how the intensity is also maybe affecting the mental health. And then you said how I can tell whether it's shock versus just a normal event. That's, I think, defined a lot by the individuals who put together the GDIS, right? So here they said it's a lot of climate events and the disasters. I'm hoping that is a level of importance greater than just a normal rainfall. I'm going to assume because they're also categorized. Flooding, not just rainfall, flooding events, drought events. For Ghana, majority of it was flooding. There are also storms and things. So it's not just your normal weather events. I'm going to trust them that is what Yes.
Yeah, I had a question that relates to about the so a lot of the data is around flooding, but do you think that other events that wouldn't necessarily count as a disaster, for example, that there's less evidence how they impact people, or it's less obvious there's extreme. There's, I think not very many people, but if you have a points in a less obvious way, I wonder whether you think that could be another.
Oh, yes, certainly. And I know that even in Ghana, there are some researchers that are looking at heat extremes, if I remember correctly, and how it affects young children in classrooms, right, who may not be able to. So I believe this study was looking at public schools versus private schools, because in private schools, presumably there's an AC system that can cool down the students. Public schools may not have access to any of that type of these types of resources. So there are some studies that are noting the importance of, trying to look at the effects of heat extremes in Ghana. I'm sure there are other areas across the country. But yes, I think that would certainly be important. You are right. In this data set, the main things are storms and flooding, and it's predominantly over 80% flooding, not so much heat. But I do believe that it's important enough that we do have growing research looking at the effects of this on children. I'm sure there are others. Yes, it's important enough that people are looking.
What might be possible in terms of segregating the city.
Well, the data set, so for Ghana, the information is available at 3 levels. When they don't have it at the district level, they have it at the region level. 1 or 2 have been at the town level in some towns, but there were not a lot of them. To what extent that they are at the town levels, perhaps it's possible. But for this shocks data, I don't know. I'm sure there's a way to. I think that there's this paper that gave a description of how the data was put together. There's a syntax to moving from one administrative level to the other. I don't know how to do that, but if you could, perhaps then you can look at these city. But I don't know. For those who have experience, perhaps you can do it. There's a suggestion that it's possible. If it were possible to get that, that would determine the analysis, right? Access to city level information on these shocks. If it were possible to do that, then yes. At this point, I don't think, when I was reading the description of the data, there are some syntaxes, at least an estimation. It won't be very.
For other regions, it's fair to say that as
So thank you very much for that question. So I would agree with you that a lot of these indicators are also, right? So a lot of these indicators, access to safe water. Indeed, if you look at the mapping for these indicators and multidimensional poverty or monetary poverty, you see a lot of them. Right? And when we run these regressions, once we control for these sensitivities, the significance for the poverty vanishes. So I would agree with you, there's a lot of that overlap the two. And even if, again, you're familiar with Ghana, you see the highest poverty level in the northern part of the country versus the southern part of the country. So even though we don't say, we don't talk about poverty explicitly, it is sort of inferred from some of the dimensions of the sensitivity subgroup, particularly the nutrition, if you will, also the housing conditions. So I would agree with you. Yes, there's a lot of overlap between that and the sensitivity indicator.
Thank you so much for that presentation.
Yes.
I just want to make some comments, not after the question.
Yes, please.
Most of the findings used to be actually related to what happened. Because from what you have indicated from this topic, a lot of things that is happening in Ghana is happening. Let me give some examples. Like in other parts of Nigeria, that's where we have the extreme case of poverty. Same also applies in northern Ghana. And then if you look at it generally, the northerners, they are not really concerned much with education compared to southern people. And this education also, in terms of the climate, affects our main time. I remember when I was in the private school, private school, anytime it rains, I'm sure that day we are going to learn anything. But when it starts raining, you just tell us, everybody, sleep, close your eyes and sleep. And for the next step, rain stops. Not do any meaningful teaching. So that gives us the fact that anytime it's raining, I'm sure that day is not going to be there. We're always happy. Then, for you to just relax. The same thing also happens when extremely hot weather conditions. During that time, we won't be able to sit in the classroom. So we'll just be told to sit get fresh air. So those affects our mental well-being. So the climatic condition at times affects mental well-being. And so it's only when we have a normal climate that we are sure that we are going to end very well. Let's say in terms of depression. So depression is more common now than teenagers. And as reason that affects in 2019. And I think one of the major reasons affecting depression is the state of the economy. Not before the COVID-19 period, the economy worldwide was somehow stable. But with the COVID-19, the economy of the entire world, no changes. Was inflation, things started changing, and that's why you see people having mental. But most of the depression are basically related to the economy. That's just people committing suicide, people just being moody, and other things. So what we are trying to say is that from 2019 up to this moment, look from your story, before 2014, the rate of growth was lower compared to what happened from 2019 up. So the state of the economy, nationally and globally, have been responsible for what we are experiencing globally.
Thank you very much for these comments. And you are right. So even though there are no controls for the state of the economy here, perhaps to some extent, that could be also included in some of the constructions, as you mentioned, even with the housing. Right? So if we have a situation where the economy is not doing so very well, the provision of maybe basic services, water, sanitation, that's likely to go down. So even though we don't control explicitly, perhaps to some extent, that's, I think it's important to point out that's potentially one of the limitations of this. There are no explicit controls as well, because at the household level, that's going to run across all of these different houses. But then some variants of these are captured.
much like so. I wondered about the temporal resolution. So for these surveys, you have the information on dates that the surveys were done in each region. And if so, could you link that to looking at whether there was a really acute increase in these mental health scores in the short period right around a specific climate shock versus the sort of longer data that you have at the moment aggregated over a few years?
Okay, so I can say that with the survey data, yes, there are dates, there are months attached, not the actual, but then there are months attached for when the survey started and then when it's ending. I can check to see the months, see if the months for these shocks exist. I didn't immediately see them for the purposes of that. I can go back and check. And if they exist, that would be a good idea, just to see if there's a spike, at least a few exact month, or maybe the month immediately afterwards, to see if in the short term there's an actual connection between that event and then the depression and then that climate event. I had not looked at this for this, but that is a great idea that I. Thank you very much. Yes, please. So thank you very much for this question, Monica. So she's asking if I am controlled for the various climatic zones in the country and if the results differ based on these. I did not control for the 3 climatic zones in the country. Rainfall, there's a savanna, but then I did control for the different regions, which are, and these zones are spread out across the different regions. I did control for regions, but not explicitly for the zones. And yes, it would be interesting to look for each of these zones, how the relationship differs. So that is, I have not looked at it for that. So I can just say that, for example, sensitivity is much higher in the northern countries versus the southern ones. Depression is also higher in those in the northern region, for example, compared to the southern region. But I didn't look at the subgroup, the analysis of these relationships for each of the 3 climatic zones. So it's possible to do that and see if there are any significant differences. So I will note this as well. So thank you for that, Monica. That's something that's also useful.